When a woman goes into menopause, that means she has had no menstrual cycles for 1 year. The mean age in the United States is 52, but this can happen a lot earlier. Anything over age 45 is considered normal, but there are about 5% of women who go into menopause under the age of 45 and about 1 or 2% that go into menopause under the age of 40. So most women are a little bit older, so the mean age is 52. We used to tell women that the symptoms would last a year or two, don't worry about it, they'll go away, but we now know that the mean duration of hot flashes and night sweats is 7 to 9 years, and a full 1/3 of women will have these symptoms and experience them in a moderate to severe way for a decade or longer. When women stop their periods, some women have no symptoms, and some women have a whole lot of symptoms that last for a long time. And those symptoms could be just hot flashes and night sweats. But the reality is that many women experience much more than that. And so it can be hot flashes, night sweats, sleep disturbance, joint aches, mood issues like irritability and anxiety and depressed mood, sexual symptoms like vaginal dryness and pain with sex. And the bottom line is that women are often surprised that they're experiencing all of these things because we don't get a lot of education when our periods are about to stop. The benefit to seeking out a menopause specialist is you know that person who has a certification in menopause management by the North American Menopause Society has that additional knowledge about what is happening during perimenopause and menopause, what are the treatments for the various symptoms that women can experience, and how do they help someone stay healthy after the menopause transition. It's really important to understand that this is a time when women have increased risk for more chronic diseases like heart disease, and how do we be proactive about assessing our risk for these diseases and staying healthy over the long term. So we will now live at least a third, if not half of our lives after menopause. And so that's a really long time, and how do you set yourself up for good health going forward? I would argue that women should be starting to have this conversation with their providers at the age of 35 or 40, so much earlier than one would expect, because women may start to have symptoms related to the menopause transition 6 to 10 years before their last menstrual period. So if you do the math, this might start in your late 30s or early 40s when you would start having these symptoms that frankly women aren't anticipating that they would have at that age. And they're surprised by it. And they're saying, wait a minute, I'm not 50 years old yet. Why am I having some hot flashes and night sweats? But the fact is that women can have these symptoms when they have even just subtle variations in their menstrual cycle length that they wouldn't even think might be related to the beginning of the menopause transition.